Some Georgians may face particular barriers to gaining and maintaining coverage under the Pathways to Coverage program. For example, low income rural Georgians are more likely to be uninsured than their non rural counterparts, but they may face structural barriers to applying for the Pathways to Coverage program, like less access to high speed broadband internet in order to complete an application. We spoke with Peach Concerned Citizens, a nonprofit, nonpartisan organization in Fort Valley that supports communities in several counties across middle Georgia. They shared about what unique barriers the low income Georgians in their community might face in accessing healthcare coverage through the Pathways to Coverage program.
The challenge here is the lack of employment for full-time, even part-time employment. Also, the lack of opportunity for volunteering. There's a couple of major employers here that we have here. The most part of employment is retail. That's retail for fast food and gas stations and some small retail stores like a Dollar General store. So with the amount of people that we have, access to qualifying hours, retail, of course, is if you do get work, it's 2 to 4 hours a day, and you might be scheduled 2 to 3 days a week. And so it's very limited. And as far as volunteer hours go, organizations that will be willing to do the paperwork, be willing to that has qualifying hours is actually outside of the city, which would be miles away. And so the opportunity for them to gain hours and to meet the qualifying 20 hours a week, 80 hours a month is limited for that reason. There's less employment here. Over the last few number of years, companies have closed, like downtown. There were department stores. They've gone out of business. And the ones that are here, they are pretty saturated with employees. There's no openings. And all of the other buildings down here, they're pretty much empty now. And I think it's because of the amount of access through the city, or through the town that is here. So there's not a large commerce area where people are coming in and bringing funds into the city because we have stores that they want to shop in, restaurants that they want to eat at. And so that's been a difficult part to meet the qualifying hours because the work is just not here. And farms do not offer that work. They are pretty much employed up without any openings. So there's not an opportunity there. And farms cover a large area of land. And so unfortunately, the individuals in the town do not have access there either. Yeah, internet is really tough. As you know, it can be limited, small bandwidth. Sometimes it's good, sometimes it's bad. If it's sunny days or weather seems to affect it. Transportation, there is no public service transportation in this area. In our surrounding areas, maybe about 30 miles away from here, there might be public transportation. And then as the timing, the amount of time that's required to wait on the transportation program that is here, and it's a small unit that usually work with the elderly. I mean, anyone could probably catch it, but they're limited in their travel and the distance that they travel. So if you were trying to get something outside of the town where you could meet qualifying hours, you wouldn't have access to transportation there. And if you did have it there, you probably wouldn't have it back because of the way the program operates. The application process, of course, having the internet, if they do have good internet, then they would be able to access the application. But then we're talking about qualifying the ability to understand the questions, to answer the questions. No assistance when there's a question that needs answering about the question on the application. And I noticed we have an access to apply online. We can apply in person, or we can apply over the internet, or we can apply by mail. So there are a few ways to apply, but each one of those have drawbacks. For instance, the office is for defects, limited hours, limited days. Applying online, that makes it tough because can we navigate the computer? Applying by phone, some people don't have good phone service here. And applying by mail would probably be the most effective. But then we've got to print out the application, fill it out, put it in. Now, it doesn't mean it can't be done, uh, but it becomes a little bit frustrating. And when people get frustrated and they don't have anyone to support them, what we're doing here is helping them with their online opportunities. We've set up a dedicated terminal where they can come in twice a day. We're going to be doing that twice. We're doing it now, but we might be doing it more. They can come in twice a day in the morning and afternoon, and we will help them set up their account, get their password, and they then will have access to go online from wherever they might be. And if not, then they can come back to the office and check whatever the results is. So that's what we're doing to help support that here at PCC. I think the program is a good opportunity for people to try to get health care. The problem is they've made it complicated through the procedures. It seems like the procedures are designed to create frustration, to create discontent, so that a person, if they get started and they don't have support, then they will get frustrated.
So we hope this information from Georgia Budget and Policy Institute and Peach Concerned Citizens helps you to talk to your community leaders and elected officials in order to help them understand that a work reporting requirement is costly for taxpayers, cumbersome for uninsured Georgians and state agency workers, and blocks us as a state from fully closing our harmful health insurance coverage gap.